All right, so we're going to jump into the medications for constipation. And the first group that we're going to look at are the bulk-forming agents like methylcellulose and psyllium. You'll find them in the store under their brand names like Citracel, Fibercon, Metamucil, Benefiber, all sorts of fun names that are out there. Honestly, so many different nurses will be working with these types of medications. These are bulk formers. They are non-digestible, and they are made to absorb water back into the GI tract to form a glutinous mass, bulking up that stool. Therapeutically, it's a fiber supplement. We can call it a bulk-forming laxative for constipation, diverticulosis, irritable bowel syndrome, and stool regulation. Stool regulation, I think, is probably a better way to look at that. The biggest side effect when it comes to these medications are esophageal or intestinal obstruction. And usually those happen because people are not taking it with at least 8 ounces of liquid, and or people are getting diarrhea and getting dehydrated. So dehydration can contribute to that too. So we want to take this with plenty of fluid, at least 8 ounces of fluid. We want to monitor stool to make sure everything's passing through okay, and monitor I&O. We want to be real careful here. Don't take if there's an esophageal or gastrointestinal obstruction. Don't take if there's a narrowing of the intestinal lumen. Don't take if the person has dysphagia. Phage with a G is like a phage, to eat in Latin. Phage is to eat if it's got that G there, whereas the one with the S has to do with speech. S as in speech, G as in good, to eat food. Dysphagia, though, is something where we would not want to be taking these bulk forming agents. Obviously, you're not going to take anything orally if you can't swallow it, right? So nausea and vomiting, appendicitis, or undiagnosed abdominal pain would also be contraindications for this medication. Of course, we want to tell you again and again, drink plenty of fluids. Report any difficulty swallowing or any chest pain, or the absence of bowel movements, right? Because we definitely want to know if there is an obstruction. We want to report any persistent diarrhea. We don't want that person getting dehydrated and then eventually then transforming into that obstruction, right? So expect soft form stools 1 to 3 days after initiating therapy. Sounds special. Okay, 1 to 3 times a day orally is when they'll be taking it. And sometimes I say these things kind of goofy just so it sticks in your head. Take it before meals may reduce the appetite. So depending on the person, that could be either a good or bad thing. If it's somebody who really needs more food and needs to bulk up a little bit, taking it before meals is not a good thing. Somebody who maybe could use a little less food, maybe taking it before meals would be okay. So decreased absorption of other meds, so don't take it at the same time as other medications.